We are in uncharted waters. We do not know what the weeks and months ahead. And let me stress, my sense, based off everything that I'm aware of, this is going to be a long-term event.
Thanks for joining us tonight. I'm Chelsea Barton in for Lynn Brooks. That was Tuscaloosa Mayor Maddox almost a year ago to this day, March 13th, 2020, during his first press conference about COVID-19 here in our community. A lot has happened in just 1 year. Exactly 1 year ago, March 11th, 2020, the World Health Organization declared the coronavirus outbreak a global pandemic. In the coming days, President Donald Trump declared it a national emergency. Governor Ivey declared a state health emergency, and Mayor Maddox confirmed the first case here in Tuscaloosa. Since then, 393,278 cases have been confirmed in Alabama, and 8,035 people have died. Nationwide, 29 million Americans got COVID-19, and 529,000 died from the virus. Worldwide, there have been 118 million cases and 2.6 million deaths. Mayor Maddox joins us live now to talk about this challenging year that we've all had. Thanks for being with us, Mayor.
Thank you for having me.
Now, out of your 16 years as Tuscaloosa's mayor, what has this year in particular taught you about this city?
Well, it's taught me that we have amazing resiliency, even in the face of an event that's lasted nearly a year and will certainly go over a year. We've also demonstrated the compassion that we've seen always when we've been met with crisis. And we've also been able to persevere and adapt, which I think has been very important, and we continue to do so. As I heard in the clip as the show opened, this has been uncharted territories, and we're all learning for the first time. But I'm really proud of the people of this community. I'm proud of our team members here at the city and in the entire Tuscaloosa County region for the way it's responded, in particular DCH Health System.
We've definitely had some bad times this year, but with the vaccination efforts ramping up and businesses opening more, where do you think we stand right now?
I think we're on the precipice of coming over the horizon with this event. Now, certainly none of us know what the variants will mean and if there's another challenge related to COVID-19, but the vaccinations have done a really good job of being targeted into vulnerable communities, which is why I think as of this evening, we had 21 total in the DCH healthcare system, we haven't seen numbers like that since May of last year. So I think we're in relatively good shape. I think the governor was wise to extend the mask ordinance, statewide mask ordinance, a few more weeks. Let's finish this off, and then let's begin in the late spring and summer to reclaim our lives.
So what is our biggest goal at this moment to move forward?
I think increasing the number of vaccinations is the key. Now, certainly the city and the county, that's something we don't control. The supply of that is ultimately comes through the federal government and state governments. But we saw a couple of weekends ago that we can deliver the vaccine if we're given it. And so hopefully more supply will be made available in Tuscaloosa County. All of our partners stand ready to mobilize that clinic so we can get thousands upon thousands vaccinated in the months ahead. We just need the vaccine to be delivered.
You hear folks all the time, I'm sure, ask, when are we going to get back to normal? I know you don't have an exact answer for us, but what do you see on the horizon for us?
I think by hopefully Independence Day, there will be a sense of normalcy if the supply of the vaccine can be distributed, and if none of the variants that have emerged in the last few months are able to circumvent the success of the virus so far. I think there's a good chance by Independence Day, if all goes well, that new normal, I don't know if we'll ever get back to what normal was prior to March of 2020, but that new normal will be upon us.
Mayor, thanks so much for joining us today. We appreciate you and what you do.
And thank you for having me, Chelsea.